Okay, in this station we will discuss the bones that form the leg, namely the tibia and fibula. Firstly, we will discuss the individual features of each bone, then we will see them articulating together. In front of you here, you can see this tibia, and actually this is right tibia. You have to differentiate in any bone to which side it belongs, okay? Then this is the right tibia, and I will tell you the features that you can differentiate the right from the left tibia. Okay, as we discussed in the femur, the tibia also we have an upper end, shaft, and lower end. The upper end of the tibia has two condyles. This is the medial condyle and this is the lateral condyle, and each condyle on its upper surface has characteristic prominences that we can see it when we tilt this bone on its upper side. Now you can see this is the upper surface of the tibia. This is the upper surface of the medial condyle, and this is the upper surface of the lateral condyle, and this surface is called the tibial plateau. Okay, it is called the tibial plateau. In between the two tibial plateaus, we have these projections, bony projection. It's called the medial and lateral intercondylar eminences. Okay, it's called the medial intercondylar eminence, and this is called the lateral intercondylar eminence. In front and behind to these eminences, we have the anterior intercondylar area and the posterior intercondylar area. Okay, the anterior and posterior intercondylar area will give an attachment to the anterior and posterior cruciate ligament, which is one of the ligaments of the knee joint, and the intercondylar eminence will prevent the tibia to sway side to side on the femur. Okay, it plays part in the stability of the knee joint. So we have the tibial plateaus, we have the intercondylar eminences, and we have the anterior and posterior intercondylar areas. Okay, this is regarding the upper features or the upper feature of the upper surface. In the front, you can see this bony projection. Here, this is called the tibial tuberosity, and this tibial tuberosity will provide an insertion for the patellar ligament. Okay, the patellar ligament is the ligament that passes below the patella, and it is the insertion of the quadriceps femoris muscle, which is the muscle of the anterior compartment of the thigh. Okay, then above here, this is the lateral tibial condyle. We have this projection here. It is called Gerdy's tubercle, and this Gerdy's tubercle, it is a tubercle for insertion of the iliotibial tract, which is the thickening of the lateral part of the deep fascia of the thigh that will be eventually inserted in this area. Okay, turning to the posterior side of the tibial condyle, we have this groove behind the medial tibial condyle, and it is a groove for semimembranosus muscle. Semimembranous muscle will be inserted in this area. Okay, on the medial side of the tibia, of the upper tibia, we have this area, and this area it is for insertion for a number of 3 muscles that form a characteristic gauze-like foot or gauze foot. It is called pes anserinus, and this pes anserinus will form from the sartorius muscle anteriorly, and behind it gracilis, and the most posterior is the semitendinosus muscle, and these 3 muscles will come from the anterior and medial compartment of the thigh, as you will see it later. Okay, so this is the feature in general of the upper end of tibia. On the lateral side, we have this. Where is it? We have this groove, a smooth groove here for the head of the fibula. Okay, for the head of the fibula, and downward here also a smooth groove for articulation with the fibula. And let us see the shaft of the tibia. Regarding a shaft, we have this is called the anterior border. Okay, we have borders and surfaces. This border coming from the tibial tuberosity and passes downwards here, and you can palpate it easily on yourself. Below the skin immediately is called the anterior border of the tibia. Okay, this anterior border will divide the tibia into surface that found medially and lateral to it. Okay, this is called the medial surface or the subcutaneous surface of the tibia, and this one it's called the lateral surface of the tibia. It's called the lateral surface of the tibia, and this lateral surface will provide an origin for the tibialis anterior muscle, which is one of the muscle of the extensor compartment of the leg. Okay, then lateral to it, to this surface, you can find this border. It is called the interosseous border. Okay, and this interosseous border will lie side by side with the interosseous border of the fibula and connected together by the interosseous membrane. Okay, this border. Behind the interosseous border, we have this, the posterior surface. Okay, we have the posterior surface of the tibia. Okay, and just medial to the posterior surface, we have the posterior border. Then the posterior border found between the posterior surface found between the posterior border and the interosseous border, enclosed between the two, and the medial surface between the posterior border and the anterior border, and the lateral surface between the interosseous border and the anterior border of the tibia. Okay, now as I said, this is an area, the lateral border here, this is an area for origin of the tibialis anterior. The posterior surface here gives an origin for the tibialis posterior muscle and other deep muscle of the posterior compartment of the leg. Okay, behind here we have this rough line. This is called the oblique soleal line. This oblique soleal line will give an origin for the soleus muscle, and the soleus is one of the superficial muscle of the posterior compartment of the thigh. Above this oblique soleal line, we have this area, this triangular area. It is called it is an area for attachment of the popliteus muscle. Okay, popliteus takes an origin from this area. Okay, now let us see the feature of the lower end. The lower end had this protrusion, and this protrusion, it is called the medial epicondyle, or the medial malleolus. The medial malleolus of the tibia. And actually, the medial malleolus is formed by the tibia, and the lateral one is formed by the fibula. Then, lateral to the medial malleolus, we have this is the surface for articulation with the talus at the tibiotalar joint or the ankle joint. Okay, behind the medial malleolus we have this groove, and this groove for the tendon of the tibialis posterior muscle and long flexor muscles. Okay, is give this groove behind the medial malleolus. Okay, medially we have this surface for the lower part of the fibula, is the medial here. Okay, so this is in general the feature of the tibia and how we differentiate the right from the left, it is very easy to put this tibial tuberosity in front, okay, or on the anterior surface, and the medial malleolus on the medial surface, and this is the tibial plateau superiorly, okay, and this is the subcutaneous border. If you put it in the anatomical position, you will find this is the right tibia, okay. Okay, this is the second component in the osteology of the leg, and this is called the fibula. And the fibula, it's always found lateral to the tibia. As you can see, it's a long slender-like bone with upper end. This is upper end shaft and lower end, as in any long bone. In the upper end, we have the head of the fibula, and the head actually will articulate here superiorly with the fossa on the lateral condyle of the tibia, okay. This will form the superior tibiofibular joint, and it is a type of synovial joint that is a plain synovial joint, okay. This is the upper part. This is called the apex. It is called the apex of the head, and below it we have the neck area here, and the neck connects the head to the shaft. When you follow the shaft downward, you will find that it has this sharp border. This is called the interosseous border of the fibula, and this border will faces towards the interosseous border of the tibia. Then it will face always medially, okay. Lateral to it, we have this another border here. It is the anterior border of the fibula, okay. Between the anterior border here and the medial border or the interosseous border, we have this called the extensor surface of the fibula. Extensor or yes, this is extensor surface of the fibula that will give rise to the extensor muscle of the leg, or the anterior compartment of the leg. Lateral to the anterior border here, we have this surface, okay, and this surface is called the lateral surface, and this lateral surface has another name. It is called the Perineal Surface, and this surface will give rise to the peroneus longus and brevis, which forms the lateral compartment of the leg, okay. Behind the lateral surface here, posteriorly, we have this whole surface. It's called the posterior surface or the flexor surface, and this posterior surface will give rise to the origin or attachment to the muscle of the posterior compartment of the leg, okay. You will find compartment muscles, the flexor hallucis, the flexor digitorum longus, and the tibialis posterior, and also it give origin for the soleus muscle, okay. And all this will passes downward, and some of them may leave groove behind the malleoli of the tibia and fibula, okay. This projection, this lateral projection here, it is called the lateral malleolus, and the lateral malleolus is formed by the fibula, okay. Behind the lateral malleolus here, we have this depression. This is called the malleolar fossa, and it always sits on the posterior-medial aspect of the bone, and we use it as a useful guide when we put the bone in the anatomical position, okay. Then when you put this fibula in anatomical position, the malleolar fossa will or should face posterior-medially like this, and this is the upper end, is the head, and the interosseous border will face medially. Then this is the right fibula, okay. And this lower facet here medially. It is the facet for the distal tibiofibular joint, which is a fibrous joint. Okay, the fibrous joint. So this is in general the feature of the fibula. Here in this articulated model, you can find that this is a fibula. Okay, this is the articulated model of the left leg. Okay, this is a left bone, it is the fibula, and the right one is the tibia. They are articulated superiorly here to form the proximal tibiofibular joint, which is a synovial joint, and distally here they will form the distal tibiofibular joint, which is a fibrous joint. And distally, this is called the talus. We will see it in a minute. And this talus will articulate with the articular part of the tibia to form the tibiotalar joint or the ankle joint. Okay, and this is the end of this stage.